Hi, my name's Stefania. I'm gonna be your nurse today. I'm gonna go ahead and wash my hands real quick and then I'll be back, okay?
My name's Ashley and I consent to being recorded.
Okay, and then I'm gonna go ahead and close the curtain for you so we can provide you with some privacy.
Okay.
Okay, and then I'm just gonna sanitize my hands. And can you just verify your first name, last name, and your date of birth for me, please?
Ashley Taylor, December 9th, 1999.
Perfect, and then it matches with the computer, so we have the right person. Okay, Ashley, why are you here today?
Just a physical session.
Okay, and do you have any allergies?
No allergies.
Do you have any pain right now?
No pain.
Okay, and do you know where are you?
Valencia.
And who's the president?
Donald Trump.
Okay, and what year is it?
2025.
Perfect. So you're alert oriented, and then I can see that your airway's clear because you're talking to me. Your breathing is good because I can see your chest racing and falling. And then for your circulation, we'll check that later with your pulses, okay?
Okay.
Okay, I'm just gonna go ahead and check your vitals real quick. Okay, so I'm gonna put the red up a little bit. Okay. And then I'm gonna get my clean supplies.
Do you have any allergies or anything like that? We do.
Okay, relax your
What's
arm.
your reaction when you
And then
ingest those substances?
So exposure to benzoyl peroxide and face swells, and for azithromycin, I have a generalized rash.
okay.
Are we in any pain right now?
No pain.
Not a good pain?
Okay, Ashley, your blood pressure is perfect. It is 110/70. And then I'm gonna go ahead and check your temperature under your tongue, and then we're gonna go ahead and check your pulse ox, okay? And then we'll do your yes. Perfect. 98.1. That's amazing. And then your pulse ox is 100. So that's great. And then so now that we're gonna start, I'm just gonna start with your scalp. So I'm just gonna go ahead and inspect for any lesions, any masses, any abnormalities, any loss in hair, or any excessive growth of hair. Have you seen any like loss of hair recently, or any hair growth like a lot? No. Okay. And then I'm just gonna go down to your face. So I'm just checking for any like symmetry. I see that's symmetric. I see your eyebrows are symmetric. I see they have good amount of hair, same as your eyelashes. I don't see any pitosis, which is that drooping on the eye. I see they're symmetric. I can see your conjunctivus pink, clear. I can see your sclera is white. And then I can see your cornea is shiny and is smooth. So I'm gonna go ahead and check your pupils. Okay. So I'm gonna go ahead and with this little light. So you're gonna go watch right ahead over there, and then perfect. And then you're gonna follow the pen.
Thyroid was nice.
Perfect. And then I can see that your pupils are equal, round, reactive to light and accommodation. Okay, and then I'm gonna check for your nose. I see that's symmetric. I don't see any abnormal lesions, any bruises, or anything like that. I'm just gonna light it real quick. And then I'm just checking. I don't see any nasal, any septum deviation, any polyps, or any bleeding, or any drainage from it. I'm gonna check your ears. I don't see any cerumen or any drainage or any blood particles, any abnormality on them. This one, perfect. And I don't see anything either. And then your ears, I can see they are symmetric to each other and to your face. Your auricle size is good. And then I'm just gonna check for your mouth, okay? So I'm gonna check, let me see, open it up. Let me see for your tongue. I see that your tongue is pink, it's moist. Also your mucous members, they're pink moist. Your uvula, it's midline, and then your tonsils are not inflamed and they're pink, okay? They look good. And then do you have any dental caries, any issues with your teeth? Okay. And I can see that they're white, so they look really good. And then now what we're gonna do next is I'm gonna check for your cranial nerves, okay? So first we're gonna do your cranial nerve number 1. So I'm gonna make you smell this, and then you're gonna tell me what you smell.
Okay. Alcohol?
Perfect. And then we're gonna do the number 2. So I can see that you wear glasses. And then do you go to the ophthalmologist every year?
I do.
Okay, and then with that one we'll be doing the Snellen chart, and then you can do that every year with your ophthalmologist, okay? And then for number 3, 4, and 6, we're gonna go and do the 6 cardinal fields. You're gonna go ahead and follow my pen, okay?
Okay.
Any issues with that? I'm just gonna palpate right here, just palpate the sinuses.
Perfect. And then I don't see any rapid movement of your eyes or anything like that, which is that nystagmus. That's how we call it, okay? And then, so now we're gonna go and do number 5. So for number 5, you're gonna go ahead and I'm gonna do some sensation, and then you're gonna tell me what you feel.
Okay.
Perfect. And then we're gonna go ahead and do this one. Perfect. And then clench your jaw, and then I'm gonna push a little bit. Perfect. And then we'll be doing your corneal reflex, but we're not gonna do that right now, okay? Because I can see it's good. Okay. And then we're gonna do cranial nerve number 7, which is your facial symmetry. So you're gonna go ahead, smile for me, show me your teeth. You're gonna puff your cheeks, and then you're gonna leave your eyebrows. Perfect. And then you're gonna frown. Perfect. And everything looks good. Everything's symmetric. And then we're gonna go ahead and do cranial nerve number 8. So for that one, we're gonna do the whisper test. So you're gonna say whatever I whisper to you. Okay.
Okay. 99.
Perfect. And then I'm gonna go the other way.
And I'm gonna touch your face and just tell me if it does the same.
99.
Perfect. Okay. And then next, what we're gonna do is it's gonna be cranial nerve number 9 and number 10. So you're gonna say okay, and then we'll be checking your gag reflex, but we're not gonna do it now, okay? Because you don't have any issues with gag, no, right? Okay. And then we're gonna do number 11. So for number 11, you're gonna shrug your shoulders for me. Perfect. And then move your head side to side. Perfect. And then with number 12, then you're just gonna move your tongue side to side for me. And then do you have any issues with like tasting or anything? Okay, perfect. Okay, so now we're gonna go ahead and palpate your scalp, okay? So I'm checking for any masses or any abnormalities, any lesions, or anything like that, any tenderness, swelling. Okay, I'm just gonna check your sinuses. Perfect, and then I'm gonna check here too. Good. And I'm gonna check both of your ears. Any tenderness, any pain?
No.
Okay, good. And then I'm gonna go ahead now next. I'm gonna check your lymph nodes, okay? So we're gonna do the posterior auricular first. Okay, and then we're gonna check the occipital. We're gonna do submandibular, and then we'll do submental. And then we're gonna do supraclavicular, which is over here. And then we're gonna check the thyroid. Okay, and then can you just swallow? Perfect. And then if I will have felt your lymph nodes, then that will mean that you have an infection. but I didn't feel any of them, okay? Okay, now we're gonna go down. So we're gonna check your neck. I'm gonna inspect it. I don't see any abnormalities, any lesions, or any masses, anything like that. I don't see anything else in your thorax or your chest. I don't see any abnormalities or anything. It's symmetric. It's good. For your precardium, I don't see that it's like inflamed. I don't see any hives, which is that rapid movement, and I don't see any pulsations or anything like that. So what we're gonna do next is I'm gonna palpate, okay? So I'm gonna check for any masses, any lesions, or anything like that. Excuse my reach, I'm sorry.
And then your injuries was just that,
Okay, perfect.
switching sound.
And then what I'm gonna do is I'm gonna now listen to your heart sounds, okay? So I'm gonna clean my stethoscope.
I'm gonna do this under your clothing, is that okay?
Yeah, that's okay.
Okay, so we're gonna go ahead and listen to the right side first, which is gonna be right second intercostal space, and the name is gonna be the aortic, okay? Okay, I'm sorry, excuse my reach. And then we're gonna do left second intercostal space. That's your pulmonic. Okay, and then we're gonna go down over here, and then we're gonna check the Erb's point, okay? And that's gonna be third intercostal space. Then we're gonna go over here, and then we're gonna check, thank you, and then we're gonna check, that's gonna be the the tricuspid, so that's gonna be the fourth intercostal space in the left side. And then we'll go down here, and then that's gonna be my mitral, and that's gonna be in mid-clavicular line, fifth intercostal space. And then I'll be listening here for a minute, so we can listen to the maximum pulse of impulse, and then that's gonna give us your apical pulse, okay?
I'm gonna go behind you and do the same thing. Take a deep breath in. And can you go ahead and lift up the back of your shoulders for me? Another deep breath. Perfect. All your lung sounds are clear. There was no wheezing, no crackling, nothing like that. There's 3 different lung sounds that we took right here. The bronchial, which is up here. The bronchial stifler, which is here right near the stoma. And the sickle is typically where you kind of traditionally talk about the lungs and everything like that. So the next thing I'm gonna do is.
Okay, and then your apical pulse was 80, so that's perfect. Now I'm gonna go ahead and I'm gonna check your arms. I'm gonna check for your skin. I can see that your skin color goes with your ethnicity. I don't see any lesions, any masses, any abnormalities, or any bruising. For your joints, I'm gonna check for edema, swelling, redness, or anything like that, any deformities. I see that they're pretty good. And then I'm just gonna check for capillary refill. Okay, and then I can see that it's less than 2 seconds. Here. Perfect, and then I'm just gonna check your skin trigger over here, okay?
Okay.
Okay, and I see that it's not tenting. Now what we're gonna do next is I'm gonna check for your pulses, okay?
Okay.
So we'll do the carotid pulse, so it's gonna be in your neck. That we're gonna do one at a time, because we don't want you to pass out or anything like that, because we don't wanna just put pressure and stop that blood from flowing to your head, okay? Okay, they're 2+, so they're good. I'm just gonna check for bruit. Okay, and then I used the bell of the stethoscope just to see if I could hear that, but I didn't hear anything. Then I'm gonna do is I'm gonna check your brachial pulses, both at the same time, so they're gonna be over here. Perfect, and there are 2+, okay, they're good. And then your radial pulses. Perfect, and there are 2+ as well. they're good. And then we're gonna go next to your lungs. So what we're gonna do with your lungs is I'm seeing that you're not using your accessory muscles or your intercostal muscles. You're breathing pretty good, with a good rhythm. I don't see that you're any like tachypnea or any that rapid breathing, okay? And you're not in distress. So I'm gonna go ahead and check for your lungs. So we'll do the ones on the front, and then I'll make you sit over here on the edge of the bed so I can check the ones in your back, okay?
Okay.
Okay, and then while I'm here, I'm gonna check also your respiration rate.
Okay.
Okay.
I got 15 for the respirations, they don't look labeled or anything, it's just totally normal. And I got some 50 for the pulse, so it's good.
Okay, so your respiration rate is 16, so that's perfect, okay? And then I'm gonna go ahead and start from left to right, okay? So take a deep breath for me.
I'm just gonna pinch on the side real fast.
Again.
Just testing for skin tone with that.
And then again.
I'm just gonna press on them, just test capillary reflex.
Again. Then one more time.
Perfect. All of them refill within 2 seconds, which is what we need to notify them.
Again.
Effective.
Good. And then I'm just gonna check on your side.
Perfect.
Okay, deep breath.
Perfect.
Good.
Alright, go
And
ahead
then
and have you
deep
squeeze my
breath.
fingers. Perfect.
Okay,
So,
and then we'll
the-
go ahead and sit up for me. Okay, and then I'll go on this side, and then I'm gonna check for the 6 places over here in your bed. I'm gonna put your hair there. Okay.
I'm gonna
Take a deep breath.
Qualified.
Again. Again.
I'll go ahead and have you lift up your shoulder.
Again.
Perfect, and just expect the abdomen looks
Again.
symmetrical and even. There doesn't
And
seem
again.
to be any
Okay. So I didn't hear your lungs sound clear. I didn't hear any abnormal sounds. So just to let you know, almost all of our lung sounds are vestibular, but then we can hear the bronchial as well, which is going to be on your trachea, and then over here on your scapula and midline for your chest, we can hit the bronchiovestibular. Okay.
Okay.
Okay. And then now that you're like that, I'm gonna go ahead and check your neck and your head that they're aligned. I'm also gonna check for your spine. I don't see that you have any lordosis, any scoliosis, or any kyphosis, which will be an abnormality in your curvature of your spine. I see that is nice and straight. And then what I'm gonna do is I'm gonna check for your kidneys, okay? So let me know if this hurts.
Nope.
No. Okay. And then I'm gonna do like this, and then you're gonna say 99.
99, 99, 99.
Okay, and that's gonna be the tactile premise, okay?
Okay.
Now we're just checking for your voice and the vibration. Okay, and then what I'm gonna make you do is go ahead and lay down for me again. Okay, and then we're gonna go ahead and check your strength that we're here in the upper. So go ahead and squeeze my fingers. Okay, then push, push again, Okay, and then pull. Perfect, you're strong. Okay, and then you're strong equal bilaterally. Now I'm gonna go ahead and check your belly. So I'm gonna put your head down. And then and let me see your belly. Perfect. And then I see that it is good, it's symmetric. I don't see any abnormalities. Your skin is good and everything looks good. And then I'm gonna go ahead and listen to it, okay? So we have to listen first, because if we palpate it or percuss it, which is with the fingers, then we can mess up with the vowel sounds, okay? Okay, over here, I'm sorry. Can I put my stethoscope? Yeah, okay. And then we're gonna start on the right lower. Okay, then we're gonna go to the right upper. And then left upper. And then left lower, okay? Because that's gonna be how the intestine moves. Okay. And then I'm gonna go ahead and listen to the abdominal aorta over here for bruit, okay? And then I'm gonna use the diaphragm for that one. It's over here. It's gonna be down the sigmoid process and upper to the umbilicus.
Okay.
Perfect. And I don't hear any abnormalities. And then I'm gonna go ahead and palpate. I'm gonna do a light palpation, and then that's checking for any tenderness, any abnormalities. Let me know if it hurts. It hurts? Okay. And then if it will hurt or you have something not normal going on with your belly, then what we'll do is we'll do the deep palpation, which is 5 to 8 centimeters, just to check for organ size, any tenderness, or any masses or anything like that. But you're good, okay? And then we're gonna go ahead and percuss. So here, I'll put. There you go. Okay. And then it's gonna be. And then we're checking for tympani, dullness, and then. So basically, for tympani, that one we can hear in the stomach, we can hear it in the intestines, okay? That's normal. And then for dullness, we should hear it more where the organs are. So it'll be like the liver or the spleen, okay? So that's gonna be on your upper quadrant.
There's no issues on the back, no moles, nothing like that. It's nice and symmetrical on both sides, which is what we expected.
Perfect. Okay. Here you go. And then I'm gonna go ahead and put you up again.
I'm just gonna do some of your vitals now, okay?
Okay, and then we're gonna go ahead and go down to your legs. So I'm gonna check your legs. We'll check for any edema, any changes in skin color, any lesions or anything like that. I don't see anything like that right now, and I can see it's really good. Your skin is very smooth and it's really good. And then I don't see any edema or anything like that. So I'm gonna go ahead and palpate your pulses over here, which is the popliteal, okay? It's gonna be on behind your knees. Okay, they're 2+, both of them. And then I'm gonna go ahead and check the posterior tibialis over here. And then they're 2+ as well. And then we're gonna go ahead and check over here dorsalis pedis. Perfect, and they're 2+. So now that I'm here with your feet, I'm gonna go ahead and check for capillary refills. Okay, and they are less than 2 seconds, so that's good. And then we're gonna check for the strength, okay? So you're gonna go ahead and push like towards your head, perfect. And then push like you were pushing on a pedal, perfect. And then so that's strong equal bilaterally. I'm gonna go ahead and clean my hands real quick, sanitize them, and then so I'm gonna go ahead and wash my hands, okay, and then I'll be back. Okay. Okay, Ashley, now we're all done. So I'm gonna go ahead and put the bed down for you.
Okay.
Okay, so you don't fall or anything like that. Your call bell's gonna be next to you. If you need anything, just give me a call, okay? And then the doctor will be right with you shortly.
Okay, thank you so much.
You're welcome.
Put it down, roll it back down.